Hello everyone, I am Dr. Anil Venkitachalam, a consultant neurologist and movement disorder specialist at Reliance Hospital in Navi Mumbai. Parkinson's disease is a progressive neurodegenerative disorder that is characterized by slowness of movement. The cardinal symptom of Parkinson's disease is tremor. It is also associated with rigidity, falls, as well as slowness of movement. It is usually a disorder of the elderly. More often it is seen over the age of 60 years of age. Parkinson's disease is traditionally a disorder of the elderly. The incidence of Parkinson's disease increases over the age of 60. Over the age of 65, there is a 1% incidence of Parkinson's disease which keeps on increasing every year. Youngsters can also get Parkinson's disease. In such a case, it is known as young onset Parkinson's disease. However, it is more common in the elderly as compared to youngsters, also slightly more common in males as compared to females. Parkinson's disease is actually a very common disorder. With advanced age, with increasing age, the incidence of Parkinson's disease increases. We always keep saying that India is a young country, but we forget that this same population is going to age at some point of time. And as this population ages, there's going to be an increase in neurodegenerative disorders like Parkinson's disease. As I said earlier, the incidence of Parkinson's significantly increases over the age of 60 to 65 years. So as the population keeps on aging, the incidence of Parkinson's disease increases. I feel that Parkinson's is underreported in the community. A lot of things are attributed to old age. Often we see elderly people who are slow, who have tremors, and people attribute it to old age rather than seek medical help. In Parkinson's disease, there are certain changes which happen in the brain. There is a degeneration in the brain, as a result of which there is a reduction in dopamine levels. Dopamine is the fuel that drives the brain. So if the amount of dopamine reduces, the body becomes slow and the body has symptoms of Parkinson's disease. There's also the deposition of proteins in the brain, as a result of which the normal functioning of the brain cells is impaired, which leads to Parkinson's disease. So Parkinson plus disorders are a group of disorders that look similar to Parkinson's disease, but they have other features. So not all the diseases which present like Parkinson's are actually idiopathic Parkinson's disease. So there's a group of disorders which are known as Parkinson plus disorders, which have certain additional symptoms like early falls, vertical gaze palsy, urinary incontinence, autonomic symptoms, sleep problems, etc. These are known as Parkinson plus disorders. Some of them may be degenerative, some of them may be genetic. These disorders don't respond very well to treatment. Some of the disorders which come under Parkinson plus disorders include progressive supranuclear palsy, corticobasal degeneration, and multisystem atrophy. There are two kinds of symptoms of Parkinson's disease. Traditionally, what are actually described are the motor symptoms of Parkinson's disease. For the motor symptoms of Parkinson's disease, remember the mnemonic TRAP: tremor, rigidity, akinesia or slowness, and loss of postural reflexes. Apart from that, the patient can have masking of faces, the patient can have siluria, drooling from the angle of the mouth, as well as urinary symptoms. The patient may have a stooped posture, which may add to the symptoms of Parkinson's disease. But the other symptoms which are also seen in patients with Parkinson's are the non-motor symptoms. This actually represents a very large group of symptoms which are often under-recognized, and patients don't always bring it out to the doctor. So the non-motor symptoms include sleep problems like REM sleep disorder, insomnia, hypersomnolence. The patient may have autonomic problems. The patient could have pedal edema, aches and pains all over the body, urinary urgency and urinary incontinence, loss of sense of smell, or severe constipation. These are the non-motor symptoms of Parkinson's disease. It is also well known that the non-motor symptoms of Parkinson's disease can predate the symptoms of Parkinson's disease by many years before the onset of motor symptoms of Parkinson's. As the disease progresses, the patient has an increase in both the motor as well as the non-motor symptoms. The patient can have recurrent falls, the patient could have freezing of gait, the patient could have severe gait instability. Apart from that, the patient could have hallucinations or drug-related problems like severe dyskinesias, swallowing problems as well as like dysphagias, and patient can have also cognitive problems like a dementia. When patient has features of advanced Parkinson's disease, the treatment becomes a challenge because the patient can have problems related to the treatment or problems related to the disease. So you're actually walking a very fine line when you're treating these problems. I've already covered the signs of Parkinson's disease, but again to recap, the patient could have a tremor, the patient could have a stooped posture, the patient may have masking of facies, the patient may walk very slowly, they may have short shuffling steps, the patient could have recurrent falls, and the patient may be lethargic. The family may actually think the patient is very lazy and not moving around. So these are some of the signs of Parkinson's disease. The exact cause of Parkinson's disease is not known. However, a lot of factors have been attributed to cause Parkinson's disease. Genetic factors have been attributed to cause Parkinson's disease. There is a huge role for environmental factors and environmental toxins that can cause Parkinson's disease. Infections can cause Parkinson's disease. Recurrent trauma or recurrent head injury can cause Parkinsonism and Parkinson's disease. Also, there's a huge group of drugs and medications which can contribute to the development of Parkinsonism. For example, commonly used drugs like antacids, etc. can cause Parkinsonism. Psychiatric medications can cause Parkinsonism, as well as anti-vertigo and anti-migraine treatment can also contribute, to Parkinsonism. Whenever you have certain signs and symptoms of Parkinson's, it is advised that you seek the help of a neurologist or a neurophysician. It is usually a clinical diagnosis. So you can make a diagnosis of Parkinson's disease by examining the patient and also by looking at the signs and symptoms of the patient. Apart from that, the doctor may advise for an MRI scan or certain blood tests to rule out other causes of Parkinsonism. We need to realize that it is very important to treat Parkinson's disease because Parkinson's disease is a treatable disorder. Good treatment options are available, good medications are available, and patients can lead a near normal life or a good quality of life once treatment is initiated for Parkinson's disease. Also today, we have advanced therapies like Deep Brain Stimulation therapy or Deep Brain Stimulation surgery which are available and can help treat advanced Parkinson's disease. Thank you.